News Channel 8 presents New Skills for Living with your host, Tom Lavin, a healthy plan for healthy living.
Hello and welcome to New Skills for Living, a show dedicated to healing and wholeness in our community. Today we're going to be exploring a very profound topic, and that's the topic of women and trauma and addiction and recovery. And so if you're interested in those topics, and I bet you are, you'll want to watch our show today. We've got a great guest, Dr. Mary Shadley. Dr. Shadley was on our show several years ago. It's nice to have her come back and join us. Dr. Shadley is on the faculty at the University of Nevada, Reno. She teaches the addictions classes at UNR. Dr. Shadley also coordinates the academic part of the alcohol and drug classes at the university, and she's a marriage and family therapy practitioner in private practice here in the Reno area. And Mary specializes in working with women who specifically have these issues of addiction and recovery and trauma. So, Mary, it's so good to have you with us. Thanks for coming back to join us.
Thank you.
All right. So, Mary, you've worked in the field for many years. You have expertise in a lot of different areas of addiction and recovery, but you've really become, I think, an expert with women, trauma, and addiction and recovery. How did you happen to focus on this issue of women and recovery?
Well, I believe one of the things that happened is I was a treatment provider, and I saw many women coming into treatment or coming to counseling and saying, "But why me? I don't get it. I don't understand what's going on with me, and I should be able to stop, or I should be able to drink," even if those were those people wanting to drink. But why is this hitting me this way? And there was this profound shame that many of the women felt. And so I started looking around and saying, well, what are we doing? And what's out there? And there were things out there, but a lot of the providers, like myself, weren't familiar with many things. And so as an instructor and an educator, I wanted to bring that to the providers as well as to my own experience.
And of course, I think one of the things that probably women were bumping up against was that so much treatment was really designed for men and male recovery issues. Can you tell us a little bit about the difference between those and how that's evolved for you and the people that you work with?
Well, one of the things, for a long time you've heard people say, well, just stop. And boy, when you go into treatment, you're going to just focus on that substance use. And we're going to just really focus. We're going to educate you, and we're going to get you focused. And we're going to only talk about prevention of relapse and all those things. Well, that's wonderful, but it's very male. It's very male-oriented, and it's been very successful for many of the men. What happened is we found that a lot of women were not getting healthier. They were not being successful in their recovery. And so we said, well, what's that all really about? Well, we found that women cannot, women's brains are such that they look at lots of things at the same time. Well, that's true in treatment as well. And so if you want to get free of substances in treatment as a woman, you want to be working on more than just the substance abuse, even though that's the variable. But you also have to be looking at, what does that have to do with how I feel about myself? What does that have to do with my history as a child, or my relationships with the people that I'm in love with or loving now? How do those all connect? And so treatment for women has really changed. So that we can focus on all of those things.
And of course, in a traditional chemical dependency recovery program, there's that emphasis on powerlessness. And would you say in your experience that men might encounter that concept differently than women do? And have you experienced that, Mary?
Absolutely, particularly because many of our women have come from violent situations when they come into treatment. Either as children, they've dealt with violence, or as one they were using. Many times they were in situations that got worse with violence or sexual assault or things like that. Well, what we know in the domestic violence field is you don't want to tell women that they're powerless.
Yes.
They already feel powerless.
Yes. It's almost like a re-victimization, or
It really is. And one time I used to do a training called Dueling Demons.
Yes, I remember that.
And coping by doping. And part of that was because I saw that many times women were coping with the issues that they were struggling with by the substance use. And to then say that you're powerless over this was not a very healthy way for them to look at it. So instead we say, you know, you have learned a certain kind of helplessness over time, and you are not, many times you have been victimized by other people, but when you use, you are helping with that victimization of yourself.
Yeah. Those are some great concepts, Mary, that after this brief break we want to catch up more with you about that. Okay. We'll join Dr. Shadley right after this brief break. Hello and welcome back to New Skills for Living. We're talking with Dr. Mary Shadley from the University of Nevada, Reno about women, trauma, and addiction and recovery. So, Mary, you talked about how women and addiction really wasn't talked about so much back in the day, but now it seems like we're hearing more and more about women being involved with various substances and women going into recovery or not going into recovery. Are women drinking and using more, or are we just hearing more about it?
Well, I think we're hearing more about it because women are not as hiding it as much. The world is different today, but we still have a lot of feelings of disrespect of self, and so many women feel ashamed of their use. But there are still other women who are saying, you know, kind of coming out and trying to join many of the men that they have been in relationship with and gotten caught up with that. One of the things we see, in fact, is that women have not known that their bodies are impacted differently. And as we are knowing that, we can help women differently than we used to. So as a treatment changes, more women are coming, more women are being able to stay into treatment because they're getting the things that they need from treatment. Therefore, we know more about what's going on. It's not as hidden.
So would you say that it's more, on one hand, it's more acceptable for women to drink and use and get loaded, and on the other hand, it's become more acceptable to go ahead and seek help and get treatment if you're having a problem?
Great. That's exactly right.
Okay.
Exactly.
Okay. One of the things that I know you're very aware of are the particular risk factors for women in developing an addiction. Mary, can you share those with us, please?
Well, what we find is that women are, if they have suffered trauma in their childhood, they are much more likely to use substances as that coping mechanism. For example, I can give you a very quick statistic. What we've found over some research projects is that people who go into treatment, if they have one drug issue, let's say they use marijuana, there's a 13% chance that they have been physically hurt as a young person, physical assault. If they have two drugs, so let's say they're using methamphetamines and alcohol, there's a 26% chance. Three drugs, it keeps going up and up and up. And so at 3 drugs, we're looking at 90% chance of having had a physical assault.
And that's pretty common, isn't it? Where there's alcohol and marijuana and methamphetamine or an opiate or a pain medication. I mean, the 3 drugs is pretty common.
It's not unusual at all.
But then when you see that, though, Mary, you see that as kind of an indication that there may be a history of trauma.
Yes.
For the woman.
Yes. And that trauma can be physical assault as a child, it can be sexual assault, it can be something that may be a rape as a young teenager. A lot of the traumas, it could also be that many of the women suffer traumas later, a little bit later in life. Let's say the death of an unborn child.
Yes.
Or a child as they are first born.
Yes.
Or the death of a child later, or the ending of a marriage. Well, sometimes those are considered very traumatic as well.
Yeah, Mary, could you tell, what is the description of trauma? When is someone traumatized?
Well, I think we feel trauma not only in our heads, we don't just think about trauma, but we also feel the trauma and hold it in our bodies. And that's one of the things that we're noticing is why some of the treatments that include, say, yoga or include some other kind of physical movement, dance, helps people release some of the trauma from their bodies. But we do see PTSD, which is post-traumatic stress disorder, in many, many women who've been in domestic violence situations, for example.
Yes. Great. That's some good information from Dr. Shadley, and we'll see you right after this brief break. Well, and welcome back to New Skills for Living. We're talking with Dr. Mary Shadley. So, Mary, you were talking with us about trauma, and, you know, there's this element of feeling victimized and powerlessness. And can you tell us more about what happens with a person who is traumatized? And the same thing might happen to someone else, but they're not traumatized by that experience.
Okay. One of the things to think about trauma is that we're a mind, body, spirit person. And so trauma itself can get stored in a variety of different ways for different people. Some people will just feel horrible about themselves, decide that they're the cause of it. Other people might store it in their bodies and have aches and pains and not be able to move very well. Or other people might deal with it in terms of an emptiness or an inability to relate to other people because they feel like they can't trust anyone. So that would be a spiritual kind of connection. But some people survive quite well and don't even, some people do it without even going into treatment. They just kind of bounce back into a very successful kind of living experience. Well, we think that that comes from resiliency, what we call as resiliency. And people can get that. I have a mandala that shows that people can use different parts of themselves. Maybe they're creative. Maybe they just, they had a horrible home life, but they formed another family that they got connected up to their aunt and uncle or the neighbor family that they got really close to. Maybe they're people who had the initiative and they just kind of powered themselves through somehow. And wherever they found it, they found a belief in themselves because somewhere they knew that they could make it when other people didn't perhaps feel that. So we hope that people can have that kind of resiliency. But for those who don't have that resiliency, that's what treatment's about. Treatment is to help you find that is already within yourself. Not necessarily that we're going to plug it into you, but it's there.
That it's there. Maybe beneath that feeling of someone feeling like they're damaged goods. Or feeling like they're not good enough, or they don't have the power or the strength.
Or that they caused it.
Or that they caused it, And that, then, of course, in your work, I would imagine you see then women who have been traumatized and they're not having that sense of empowerment. They're turning to alcohol or drugs to escape or to feel some sense of power, or they continue to repeat abusive relationships, don't they, Mary?
Yes, they do. I think substances tend to be two things. One, it tends to numb, which is great. I mean, that's why people use it. If it didn't work, we wouldn't use substances. So it numbs, but then also when you're numb, you may not notice other times in other situations that are dangerous. And so sometimes women who are using then end up in more difficult situations. So that doesn't help them, obviously.
Not at all.
And they'll pick a relationship or end up in a relationship. I don't think they pick. I don't think women pick bad relationships. I think they end up in relationships and those things dismantle.
So in terms of then a woman who's been traumatized or a woman that's having a problem with alcohol and drugs or both of those, they frequently do not share with other people the problems or the difficulties that they're having. Can you share with us why don't they share about what's going on with them?
Well, I think we still live in that world that we're supposed to be good mothers. We're supposed to be nice and sweet women. We have this image of what we're supposed to be. And when we don't fill that because our lives are disheveled and our our feelings about ourselves are a mess, then we tend to hide that. We don't want to tell anybody. In abusive situations, we're told, women are told, you know, you're no good, nobody would want you. Yes. And so that kind of thought then becomes the thought. It may have come from somewhere else, but we begin to hold it as our own belief. And so we don't tell anybody anything.
Yeah. And a lot of children who are traumatized are told, if you tell anybody, I'm going to hurt so-and-so, and so they're, by holding it in, they're kind of protecting their family, aren't they?
Absolutely.
Even if it might have been 30 years ago, they're still in their consciousness, maybe protecting them.
Well, and there's a certain embarrassment, you know, I shouldn't be in this place. Nobody would think, I mean, here I am, I'm using.
Yeah.
Look at our societal viewpoint about people who use. We have some really negative viewpoints about that.
Yeah. Is that one of the things, and we've got about a half a minute here, Mary, is that one of the things that you talk with women about, though, is kind of re-understanding how they might have turned to alcohol or drugs, and that doesn't mean they're a bad person or they're...
Absolutely.
Yeah.
That it's a coping mechanism, but it's not necessarily a healthy coping mechanism. We want to find some other things that will get you that same support and that same kind of out of the difficulties, but with something that will also get you the good things.
Yeah. So, Mary, when we come back, I hear that you're talking about when the woman comes in, validating her and then offering her hope. And we'll want to hear more about those themes after this brief break from Dr. Shadley. We'll see you in a minute. Hello and welcome back to New Skills for Living. We're talking with Dr. Mary Shadley from the University of Nevada, Reno. She's also in private practice here in the Reno-Sparks area. So, Mary, we were talking at the end of the last segment about when you encounter a woman, it sounds like one thing you're wanting to do is validate her experience, and the other thing you're wanting to do is offer her hope. Can you share with us more about that?
Well, I think one of the things that we want women to understand is that you can have a different life. Life can get better. And it may be hard, there may be some struggles during that time, but it may be surprisingly, there's some things you can do that would surprisingly move you back into that kind of world, into a happy world. One of the things that there's some research out, for example, you know, that whole belief that people will, if stressed, they will fight or flight. Well, the new research is actually showing that women, when most stressed, will tend and befriend.
Well, that's interesting. That's a different paradigm, isn't it?
It's a totally different paradigm. And so it really supports what women are like many, many times, which is if you can tend to those you love and still have your friendships, increase your friendships, support them as well as yourself and your children as well as yourself, and how to do that in a way that really allows you to get that nurturing. That's a recycles.
Yes.
You give it out, it comes back.
Yeah. So in a way, you're actually just asking women to do what comes naturally to them.
Absolutely.
In terms of tending and befriending. I like that. Yeah. What else can you tell us then, Mary, about this aspect of recovery and offering hope and having a life?
Well, I think we can help women to really know that you can be strong and still be very feminine. Or you can be gentle and be strong. There's, you know, it comes from different ways. Women get to be who they are. And every woman is uniquely themselves. So we want to support them in being able to do that and to find their voice, to find the ability to stand in their spot, to know that I don't have to back away. I don't want to get into a fight. I don't have to back away, though. I am who I am, and I can recover. I can move into a whole different world that I haven't been in before.
So someone who's been traumatized and kind of cowering at life and is afraid, you help them find the power to be who they really and truly are, and that they don't have to turn to alcohol or drugs. There's something natural within them that to allow them to bring that forth, Mary?
Absolutely. And I really like the way you said they cower perhaps not necessarily from someone else, but they cower from life. And what we want is really to help people come into their lives.
Great.
Because life is full. There's many, many wonderful things that we can help women find within themselves.
You know, Mary, in this last minute, you know, a lot of people are kind of afraid of therapy if they've never been, or they're afraid of treatment. Maybe in a minute, can you kind of give a brief summary of kind of reassuring people what goes on in treatment? You know, they see things on TV and they're afraid people are going to yell at them or beat them up or confront them like we were talking about during the break. And can you just share a little bit about modern treatment today?
Well, I think the most important piece is that we are much more supportive in therapy today. Yes, there used to be a thing about drug and alcohol where you had to confront people and tear them down so you could build them back up. We know that that doesn't work. What really works is to support people and to help them face these obstacles, but to face them, and it's like we're walking with them and facing them. We're not totally leading, but we're not pushing them either. We're walking with them. And I think when we think of it in that way, it's a relationship. If you go into therapy and you go, I don't feel comfortable here, well, it may just not be a good match. It doesn't mean it's a terrible therapist, and it doesn't mean there's anything wrong with you. It just may not be the right match. So don't give up.
Don't give up on therapy. Go find someone else that's a better match.
Absolutely.
Well, Mary, as I shared with you earlier, I think we have to have you back for a couple of more shows. We could really keep going here. We appreciate you coming in and sharing your experience and expertise. I want to remind people, if they go to the website, there are over 80 newsletters that deal with topics of addiction and recovery and self-esteem and depression and anxiety and finding meaning in life. These are free for you to view on the website or to copy and share with your friends. Also, hopefully up on the website, you'll be able to watch Dr. Shadley's show as well as other shows on the website. We want you to join us next month as we continue the series on addiction and recovery. Thank you for joining us.